Dental fillings are an everyday dental procedure that the majority of individuals will need at one moment during their lifetime. If it's because of tooth decay, a damaged tooth, or outdated fillings which need to be replaced, fillings for dental cavities can be a vital component of maintaining good dental health. How much will dental fillings cost? In this clip, we'll explore the elements that influence the price for a filling in the dental area and offer some advice about how you can save cash on this procedure. The cost for dental fillings may vary in accordance with a range of variables, such as the area of the dental clinic as well as the type of filling material utilized, as well as the difficulty of the procedure and the presence of dental insurance. In general, the price of fillings in the dentist range between $100 to $500 for each tooth. One of the primary elements that influence the expense of a dental procedure is the kind of filling material utilized. There are many different kinds of filling materials, which include amalgam, silver, fillings, and dental composite, tooth-colored, fillings filled with gold, amalgam fillings, as well as ceramic fillings. The amalgam fillings are usually the least costly option, but ceramic and gold fillings can be more expensive. Fillings made of composite are a preferred choice among many patients due to their ability to blend into the natural hue of teeth. However, they could cost more over amalgam ones. The place of the dental practice could also influence the cost of dental fillings. Dentistry in urban areas or in affluent regions are likely to charge higher to cover their costs than dental offices that are located in rural or in less affluent regions. It's recommended to look around and examine the prices of several dental practices to get the highest cost for your dollar. The level of difficulty could also impact the cost for a dental filling. If the filling is put in a difficult-to-access area within the mouth or there are any complications in treatment, then it might need more time and skills on the part of the dentist. This can lead to a more expensive price. If you're covered under dental insurance, then the cost for a dental filling could be fully or partially covered dependent on the plan you have. It is important to inquire with your insurance company for details on what's covered as well as what your out-of-pocket charges could be. There are some dental insurance plans that be subject to a waiting period prior to when coverage starts, and you should plan ahead when you're certain you'll require a dental filling within the next few years. There are many options to cut costs when you need a dental filling, even when you don't are covered by insurance or insurance does not cover the whole expense. You can look at discount plans for dental services available at some dental clinics and online. The plans usually offer reduced costs on dental procedures, which include fillings and other services to those that pay an annual or a monthly charge. Another alternative is to ask your dentist whether they can offer cash discounts for those who pay for their services upfront or fully at appointment time. A few dental clinics may offer payment plans to patients who require financial assistance. In the end, the price for a dental filling may be contingent on a range of elements, including the filling type that is used, the place of the dental practice, as well as the difficulty of the procedure and the extent to which you've got dental insurance. You should conduct investigation and look at prices of several dental practices to get the highest cost for your dollar. If you're not covered by insurance or won't cover the entire cost, you have options to save you money when you get a dental filling. Be aware that maintaining your dental health is vital to your overall health and well-being. Don't be hesitant to seek the dental treatment you need.